Welcome to Ingrid's World television show. My name is Ingrid Paris-Hicklin, and I am the host and executive producer of the television show. I am thrilled you are here watching because this episode you get to meet Inova Schar Cancer Cancer Institute, which is a state-of-the-art cancer center in the Washington, D.C. metropolitan area. From Inova Schar Cancer Institute, we will be speaking with Laura Matthews, Vice President and Administrator. And then we'll be talking with Dr. Danielle Shafer, Medical Oncology, Hematology, Internal Medicine. And then Jennifer Bires, Executive Director with Life with Cancer and Patient Experience. So grab your electronic devices because you're going to be getting lots of information that you want to remember. Well, welcome to the show. I am so thrilled to have you all here. Laura Matthews, can you give us an overview of the Schar Cancer Institute?
Absolutely. Thank you so much, Ingrid, for having us on today. The Inova Schar Cancer Institute is the name for all of the cancer services that are provided by the Inova Health System. And we have the incredible honor and privilege to be located here in Northern Virginia. And we provide cancer care for patients really throughout the region. We have multiple locations. Our flagship is here in Fairfax, which is our largest location. We're located right on Gallows Road, right across the street from the main campus of Inova Fairfax Hospital. But then we also have locations out in Loudoun at Inova Loudoun Hospital, at Inova Fair Oaks Hospital, in the eastern region in Alexandria, and even as far south as Woodbridge for radiation oncology. And so we truly have the ability to provide incredible cancer care for patients close to home, wherever their home may be in Northern Virginia.
Wow, that's amazing. So introduce a video. We're going to get an overview of the Inova Schar Cancer Institute. Can you introduce that video, Laura?
Absolutely, yes. So the next couple minutes, we'll be watching a video that really provides an introduction to our program and primarily here again in Fairfax, and a little introduction to the subspecialty care that we provide. So we know that patients aren't just diagnosed with cancer, they're diagnosed with breast cancer or lung cancer or prostate cancer. And so keeping in mind that personalized care that really drives everything that we do from the building to the programs. And so the coming video will tell you a little bit about what we offer.
Thank you so much, Laura. We're going to watch this video and then we'll come right back. I hope you all enjoyed watching the video, and now let's continue with our conversation with Laura Matthews. So we're going to talk about, explain what are the steps involved in receiving treatment at the Inova Schar Cancer Institute.
So, as I mentioned earlier, the Inova Schar Cancer Institute is incredibly focused on very personalized care. And so, once a patient is diagnosed with cancer, they can call our Schar Cancer line, 571-472-4724, to be connected with one of our disease specific new patient coordinators. And so, as I was saying earlier, each cancer is very different. And so, we have developed full teams that are very focused on each specific type of cancer. And so a new patient coordinator who is very well versed and very knowledgeable about what might be needed for that type of cancer will take that initial phone call. They'll speak with the patient about the types of images or medical records that may be needed, and connect that patient also with a disease specific new patient nurse navigator. And so the nurse navigator and the new patient coordinator partner together to make sure that we're providing all of the information that a new patient may need and getting that patient scheduled for their first visit here at the Inova Schar Cancer Institute. So having that disease specific team, we think is just an incredible opportunity for patients to be able to ask questions that they might want to ask, to feel supported from their very first phone call, and to have that specialized team that's there to care for them from day one.
Great. So let's now talk about the work in medicine. Dr. Shafer, tell us about your work in medicine.
So I take care of patients with blood cancers. So those are things people may be familiar with, would be diseases like leukemia or lymphoma. Um, I started taking care of cancer patients early in my training, and one thing is people always ask, well, how did you end up in oncology? And I would say it was because of the patients. So when I was in my internal medicine training, I was drawn to the patients and the unique relationships they had with their oncologist, and they were just really amazing people. And so it's been a privilege to be a part of their lives.
So, what is the background of cancer and treatment? What's the background?
Oh, that's a really a great question. And in the field of medicine, oncology is actually, particularly chemotherapy, is actually pretty young. Some of your viewers may be aware Nixon declared war on cancer in the 1960s, and that kind of launched much of the research into cancer and the National Cancer Institute. Cancer is
Wow.
very generic term. It basically refers to abnormal growth of cells, and they've kind of lost the mechanisms where they should normally die. And the treatment is quite varied. So we use a number of different modalities depending on the cancer. So some cancers are treated with surgery, some with radiation, and some with chemotherapy. But chemotherapy is very much expanded. And so we use in breast cancer, we use hormonal therapy. You probably have seen ads on TV for immunotherapy. So those are therapies utilizing the patient's own immune system to try to keep the cancer in check. So there are a lot of different ways that we treat cancer now as compared to 50 years ago.
Wow. So, what types of cancers do you treat there at the Schar Cancer Institute?
So we treat a wide variety of cancers. We treat basically all adults with cancers so that would be age 18 and above, with all the common cancers, which are things like breast cancer and lung cancer and colon cancer, and then the more rare diseases, for example, some of the unusual leukemias or lymphomas and other types of cancers.
Wow. So tell us also, Dr. Shafer, about about other health institutions that you work closely with to support the health of your patients.
Yeah, so we're I would say quite collaborative. We have a lot of collaborators inside the institution. So we work with our radiation oncology colleagues, and we work with our surgical oncology colleagues, and we have patients. We have cardiologists that specialize in the field of cardiac oncology. All these different groups in medicine that help us take better care of our patients. Outside of the institution, we have our own clinical trials here, and then we'll often, sometimes if we're referring patients to other institutions for other clinical trials, always trying to find, really the best care for our patients.
Wow, wonderful. Very good to know. So now let's switch and talk about life with cancer at Inova Schar Cancer Institute. Jennifer Bires, tell us a little bit about that.
Sure, yeah. I like to think of Life with Cancer as the psychosocial educational arm of the Cancer Institute. So we have a team of behavioral health therapists, oncology dietitians, nurse navigators, and a pretty robust fitness program to help support people from the day of diagnosis throughout their trajectory, including caregivers and family members as well.
Wow. And the services that you're offering, what are the services that you're offering there?
Yeah, we offer about 150 programs a month. So that ranges from our fitness classes to our support groups to educational programs that may help with a specific symptom or side effect. We also offer one-on-one behavioral health therapy, one-on-one work with an oncology certified dietitian and a nurse navigator. We have a psychiatrist on staff, massage and acupuncture. And everything we offer at Life with Cancer is offered free of charge to patients and their family members. Certainly those who are treated at Inova, but really anyone in the Northern Virginia community who needs access to supportive care because of a cancer diagnosis.
So why would a patient want to seek out the services, of Life with Cancer?
I love that question because really we know that cancer can be an incredibly difficult diagnosis. And what we do at Life with Cancer is help support people through their treatment. Listening to Dr. Shafer talk about the exceptional medical care that we provide here, part of good care is whole person care. And so while our physicians do an incredible job picking the right medicine and making sure that people have what they need on that end, we make sure to help with the emotional impact or the educational needs of patients as they're going through a diagnosis. And what we find really is that when we all work together, patients really do much better with their treatment and really have a much higher quality of life because we're able to take care of all of the pieces of them that may be impacted during a diagnosis.
Wow, thank you. Let's now talk back with Laura Matthews, and what are the present and future needs of the Schar Cancer Institute?
The Inova Schar Cancer Institute, as Jennifer talked about and as Dr. Shafer talked about, is very much focused on caring for our patients throughout their entire cancer journey, from before they're even diagnosed, through their treatment time, and then even after into survivorship. And so some of the needs that we have found in the community are really around screening and prevention. So we recently opened our Seville Cancer Screening and Prevention Center, and it's all focused on ensuring that patients are getting those cancer screenings in the appropriate time. We know based on data that patients in Northern Virginia who may be eligible for mammography, may be eligible for a colonoscopy based on their clinical based on clinical guidelines are not going through and not getting them. And it is so critical for us to find cancers early because we know that there are better outcomes the earlier you find and diagnose those cancers. And so we think having our screening and prevention center here is really an incredible need to continue to grow that and to spread awareness about the screening and prevention center. We're also kicking off a survivorship clinic. So this is something that is very new, but we think it's incredibly important for patients after they have completed their active treatment to have that, again, subspecialized, very expertise care into the next phase of their cancer journey, which is survivorship. And so we've just started that for breast, head and neck, testicular, and prostate cancer patients. So really excited about that. And then moving into the future, one of the things we want to provide close to home is a bone marrow transplant program. And so this is something that currently we're partnering with the University of Virginia to provide, but we are going to be building up our own program here at Inova Schar. And so really excited to do that and to move into the future to be able to provide not only bone marrow transplant, but CAR T therapies and excellent clinical therapies for our patients as well.
Oh my goodness. Did you say CAR T therapies too?
Correct. Yep.
Oh my. All right. So let's go to this question, and I will ask Dr. Shafer to be the lead on this. What is your one thought that you want to leave our viewers about the Inova Schar Cancer Institute? Dr. Shafer, What's your one thought?
That's a challenging question, but
You
I
can give
think that we
two.
offer really compassionate, personalized care to our patients. And I think this isn't just one thing, but I think having this Life with Cancer program really augments the care that our patients receive and really helps deliver, 360-degree, if we can call it that, care, trying to address all of their needs.
Right. Um, Laura Matthews, how would you answer that question?
I think Dr. Shafer covered it very well. I always say that Inova Schar provides the care that I would want, or I would want for my family members or my loved ones. And I think that just speaks volumes to the team that we have and the incredible care that we provide for the whole patient.
I understand. And let's go back to Jennifer Bires. You talked about life with cancer. What's your one question, one thing that you want to leave our viewers with?
I think I would want viewers to know that cancer can be really difficult, but no one should do it alone. And I think one of the great things here is that we have a lot of the components that can help someone through a really difficult diagnosis, and really just that people take part in the resources that are available to them. That can be an important part of success.
Excellent. Okay. And then where are there opportunities for the community to help? Jennifer, you're on camera. Talk to us. Where can the community help?
One great area that folks can help with is we have a great patient, family, and advisory committee, a PFAC, and we really count on patients to help us continue to make the process and the experience better. And so the patients on that committee bring great ideas to us. They talk to us about their experience. They tell us where we're doing really well. They tell us where some of our challenges are. And so our volunteers who are part of our patient and family advisory committees are incredible assets, and they give so much to us as we learn how to really improve upon the care that we're giving. And so that's really one great place that we can utilize patient feedback and support from community members.
Wonderful. And going back to, let's look at another question here. Getting more information about the Inova Schar Cancer Center. Laura, what's the best place to get that information?
I would say our website is probably the best place to start out. Our website is www.inova.org/cancer. And so on our website, that will give you links to pretty much any of our subspecialty programs. It will also give you a link to our Schar Cancer Screening and Prevention Center, or you can always feel free to give us a call. So again, the number for the Cancer Institute is 571-472-4724, and we're here Monday through Saturday to be able to answer the phone, answer any questions, and really happy to be here as a partner, as Jennifer and Dr. Shafer alluded to.
Wonderful. All right. Well, I'm just telling you that it's a privilege having you on. And I would say just one question that I'm just going to add, because I have, a minute. What brings you joy about working there at Inova Schar Cancer Center? What brings you joy, Laura Matthews?
It brings me incredible joy just to help the patients of our community, to be a part of Northern Virginia, and to be able to provide the care that we provide to almost 1,000 patients a day. It's not an understatement when I say it's an honor and a privilege, and it is just so meaningful to be a part of this team and a part of this organization.
Wonderful. Jennifer Bires, what brings you joy about working there at the Inova Schar Cancer Center?
Yeah, much like Laura, the patients bring me so much joy. I think it's really incredible to be able to walk along someone in this journey, and to do it at a place that has the resources to really support a patient while they're going through it, and their family member feels so important. And so working here and getting to see the patients and getting to really help improve their experience brings me a great amount of joy, and makes this a really important place to be.
Dr. Shafer, thank you so much, Jennifer. Dr. Shafer, we're going to give you the final word. What brings you the joy of being there at the Inova Schar Cancer Center?
Well, I have to echo my colleagues, of course, because it is so true. The patients are just phenomenal, and to be able to help our community is fantastic. But I'd also like to echo, or I'd also like to say that to our colleagues are fantastic. I mean, I can't tell you how many patients will say, even the dietitian, the people delivering their food, or the valet, that this place just means a lot, and the kindness that people extend to them. And I think to work in a place where so many people can say that is pretty awesome, and to know that we're all working to help the community.
Wow. Well, thank you so much, Dr. Shafer, Laura Matthews, and Jennifer Bires, for being on Ingrid's World to discuss your work at the Inova Schar Cancer Center. Your in-depth interviews provided insight into a nationally renowned cancer care institute. My inspirational quote is from Vice President Kamala Harris: "The American dream belongs to all of us." Thank you for watching Ingrid's World, and connect with me on Facebook at Ingrid's World, or follow the show at Ingrid's World VA in Twitter and Instagram. Never miss a show, because Ingrid's World is on Ingrid's World LLC YouTube channel and ingridsworld.org. Thanks for watching.